I'm Dr. Jerry Hesch, a physical therapist from Hesch Institute in Aurora, Colorado. And this is Rose. I'm grateful to her. She's a rolfer, and she's allowing me to film her neck. Can you tell us a little bit of your symptoms?
Tightness at the base of my skull that lead to headaches frequently. Whenever anything else is tight, it comes back into here.
And how long have you had the tight upper neck?
Ongoing, more and more the last 3 months, but certainly over my life.
Aha, interesting. Okay. And you contacted me to treat your low back.
Yes.
Because that was the acute event, but in doing a whole body screen, I found this restriction in the upper cervical. I like to test the neck doing traction in neutral. Go ahead and put your feet out straight.
Yep.
And so I have the legs out straight, and the contact has to be on the temporal region. It has to be in front of the ear, and it can be a little bit of face, a little bit of temple, a little bit of parietal. But as long as you're here, your contact is on this part of the head and face, then that traction is going to be isolated to the upper two cervical joints, the occipito-atlantal and the atlantoaxial, because both of those joints are right below the mastoid process, right below the pin of the ear, whereas all the other facet joints are behind in the posterior column of the neck. And so I'm testing traction, and I can see her feet bob up and down. I can freely create movement. Okay? So then I also want to test it in 15 degrees of flexion, same contact, and she moves freely. And then I bring her head into extension, just 10 degrees of extension, and all of a sudden it's very restricted. So I cannot create any movement. I can't see those feet move up and down at all. So she has an extension fixation, extension and anterior glide of the atlas. And that makes her head rather heavy. I'm trying to lift her head straight forward, straight up towards the ceiling, and it's very heavy compared to a norm. But if I come down and I capture that big bump, which is C2, and I lift her at C2, I can easily lift her up. But I have a hard time getting past the OA joint and past the atlas and axis. Okay? Getting past C1, C2. But I can grab 2 and lift it up there, and it moves very freely. The other thing you'll note is that if you come beneath the mastoid process, then you'll land on the transverse process of C1. And I'm trying to push her neck over to the right, and now I'm trying to push it over to the left, and there's this significant restriction. If I come down to C2, just one finger width below that, boom, we have free mobility. And we have free mobility in both directions. I also like to test side bending of the occiput, and I do that with the mastoid, and that's free. Okay, free on this side, and I come on top in front of the mastoid, and I spring it, and it springs left, and it springs to the right. And so I'm implicating not the occipito-atlantal, but I'm implicating the atlas, C1, as being hyperextended and also stuck in a little bit of anterior glide. And this is a nervous system pattern. I'm not using language like subluxation. I'm talking about how the nervous system has created this pattern of restriction, and the nervous system uses muscle. Okay? Now we could work on her muscles, but I know an easier way to unlock this pattern. I know an easier way to work with the nervous system, and so I'm going to choose that alternate route. And she has access to good soft tissue work in her community, so I'm going to defer to them to let them follow up with soft tissue work. I'm going to do traction mobilization of the atlas and see if we can change the programming of that nervous system. So you'll recall she was very restricted in extension, and so what I want to do is treat her in close to neutral, but I'm going to take her into about 5 degrees of extension. And in that position, I can just barely get a little bit of movement. So one of the basic tenets of this approach is that you always treat the motion restriction in whatever degree of flexion or extension that you can just begin to gain some motion. And we could have a long philosophical debate about why that is so, but I'm not going to do that. Basically, when we had her in 15 degrees of extension, her upper cervical was very locked. In 5 degrees of extension, I can do this traction specific to the upper cervical, and I can see her feet bob just a little bit. So I'm going to set my timer for 5 minutes, and all I'm going to do is, again, contact this part of her head. Okay, my fingers really don't do much. And then I'm going to just do traction towards my belly, and I'm going to maintain that for 5 minutes. So I'm not going to film for 5 minutes because the scenery is not going to change. It'll be the same traction for 5. So I'll film her response to treatment after we're finished.